The idea originally started about a year ago with Central States Center for Agricultural Safety and Health, and it was in conjunction with the University of Nebraska Medical Center out of Omaha. And we were approached whether we would be interested in doing some of these safe farm evaluations, and we actually did receive a grant then from the Center for Agriculture, Safety and Health, and that's how it all got started. What we're going to be looking at today is like slow-moving signs on the back of the equipment, reflectors, reflective tape, so that when they're out on the road operating their equipment that other motorists can see them. We're going to look for, auger protection. There's a tremendous amount of farm-related trauma injuries that happen when somebody gets an arm or a leg caught in an auger, and so that's a big issue. So it's those things like that that we're looking for, and a lot of times farmers, they take, and it's not because they want to, it's just because in the hurry of things with harvest that they maybe forget some of those things, and then, when you're least expecting it, that's when an accident happens.
When you're taking care of people who live in the rural areas, oftentimes the things that might cause illness, the origins of the illness are a little bit different. We know that farmers suffer from hearing loss, and one of the things they can do is wear protective equipment for that. Other things are sun exposure. So we do emphasize the use of sunscreens, broad-rimmed hats, long sleeves, anything that's going to help keep their sun exposure down, because there is a higher incidence of skin cancer in this group. Beginning nursing students will actually do the vital signs because they have been trained in that. And then at the end, the junior students will also be sitting in as the senior students take the whole health risk assessment and all the screenings we've done, analyze that information, and then sit down with the individual to say, these are some things we feel that you need to pay attention to, and these are some ideas. And then they're just going to have a conversation with them and say, what do you think you can do about this? To hopefully empower the individual to make that change. We know that, especially with the emphasis on prevention that we are seeing in health insurance coverage and with the Affordable Health Care Act, we really need to be training our students to serve the population that they are going to be living among. And rural America, rural Nebraska, is among the populations that they're going to be here to see. So they need to know what they're looking for and understand the culture and the values of the people they serve.
Our plan is to come back again in a year's time if these farmers will let us, and to do another evaluation to see if anything has changed or whether they have made any of the improvements, and then we can go from there, to whether it's being effective or not. If you look at it in a broader sense, it was the original goal of Central States Center for Agriculture, Safety and Health to kind of put together a broad set of data from a number of different farms across the Midwest, and to show that if there were farms that were actually rated higher in safety, that they possibly should be able to get some kind of a break on their insurance. Because if you look at the farm industry, it ranks probably one of the highest industries in the United States with workplace fatalities or workplace traumas. And so that's what the whole idea about this is to try to lower those numbers down and just make farmers aware of some of the safety issues that they take for granted.